Multifaceted Amblyopia screening. We will look at the 2-in, the PDI Check, and the new blinq screener with input from all the developers. The birefringent scanning with blinq started out back in 1991 and became commercially available in 2019. The device now provides pass, refer, timed out, and inconclusive results. And here is recent validation. PDI Check is a autostereoscopic game to be played on the Nintendo 3DS. It provides output in stereo, monocular visual acuity, and color. The 2-in is an infrared multiradial photorefractor that can provide refraction and estimates of strabismus or ocular alignment. For this study, we did not use the Adaptica Kaleidos tube or the infrared cover wand. Which photo screener can do the best job at identifying small angle strabismic amblyopia? The PDI Check is a forced 4 method touch game using the autostereoscopic upper screen to test for stereo and monocular visual acuity. It has minimal floor effect on those visual functions.
Pretty good.
The 2-in was able to determine refractive error and aspects of corneal reflex ocular alignment. The blinq with COVID masking was calibrated above the mask and then used to determine the level of foveal alignment by birefringence. From various different photo screening devices, we decided to evaluate 3 different types of screeners on 202 patients, multiple ethnicities. 66 had not yet been treated for amblyopia, and they had a high prevalence of amblyopia risk factors. Each patient was randomized in the order with which they were screened by all 3 devices. Then each received a confirmatory exam with careful, deliberate refraction. These were then compared to uniform outcome targets from which receiver-operator characteristic curves, or ROC curves, could be compared. We used the AAPOS most recent uniform guideline target and also the Hunter 24-point rubric target. The refractive amblyopia risk factors was best targeted by the photo screener. Strabismus was best evaluated by the autostereoscopic or birefringent screening, as with amblyopia, and using Hunter's new rubric. The PDI Check had good correlation of stereo visual acuity and delta visual acuity, also using Bland-Altman plots. And the PDI Check was well able to determine red and green color blindness. The 2-in was compared to careful refraction, showing good vector transformation with some underrepresentation of high hyperopia. Using the ellipsoid spectacle match, there was also a good comparison with appropriate refraction. We did not use the CR function in the 2-win for this study.